Right now, there's a good chance a device on your wrist or in your pocket is tracking your steps, your heart rate, and how well you slept last night. Healthcare is being quietly reinvented, not just in hospitals and labs, but on your phone, your watch, and in the cloud. This is the world of digital health, and it's one of the biggest shifts in medicine in a generation. In this series, we'll explore it piece by piece: wearables, telehealth, health apps, and more. But let's start with the big picture: what digital health actually is, why it's exploding now, and what it really means for you. So let's define it, because digital health is a term that gets used a lot and explained rarely. At its simplest, digital health means using technology, smartphones, wearable devices, apps, sensors, the internet, and increasingly artificial intelligence, to monitor, manage, and improve our health, and to deliver care in new ways. The key thing to understand is that it's not any single product or gadget. It's a broad shift in two big directions. First, in how health information gets gathered, moving from occasional measurements at a doctor's office to continuous data from your own devices. And second, in how care gets delivered, increasingly reaching people at home, on their phones, and outside the traditional clinic walls. Put simply, digital health is what happens when the technology revolution finally arrives in medicine. And it touches everything from fitness tracking to how a hospital manages a chronic disease. A natural question is, why is this happening now, and not 20 years ago? Three forces converged. First, the hardware finally arrived. Nearly everyone now carries a powerful smartphone, and the sensors that measure heart rate, movement, and more have become tiny, accurate, and cheap enough to put in a watch or even a ring. Second, artificial intelligence matured. All those devices generate a fire hose of data, and AI is what makes it possible to actually interpret that data and turn it into something useful. And third, the healthcare system itself is under enormous strain, from rising chronic disease, aging populations, and spiraling costs, which creates huge pressure to find more efficient, preventive, and scalable ways to deliver care. And then the pandemic hit, and accelerated everything, normalizing virtual doctor visits almost overnight. Hardware, AI, and urgent need, all arriving at once. That's why digital health went from niche to mainstream so fast. Digital health is a big tent, so let's map out the main territories, each of which will give its own episode later in this series. First, wearables and trackers, the Apple Watch, the Oura Ring, Fitbit, and many more, streaming continuous data about your heart, sleep, and activity. Second, telehealth, seeing a doctor or therapist by video call instead of traveling to an office. Third, remote patient monitoring, where people with chronic conditions like diabetes or heart failure are tracked safely from home, with data flowing back to their care team. Fourth, digital therapeutics and health apps, software that's actually designed to treat or support a condition, from prescription-grade apps to the wellness apps on your phone. And fifth, the AI layer running through all of it, health coaches, symptom checkers, and tools that support doctors' decisions. That's the landscape. If it feels broad, that's the point: digital health is less a single thing and more an entire ecosystem. So what should we make of all this? The promise is genuinely exciting. Digital health could make care far more preventive, catching problems early instead of late. More personalized, tailored to your individual data rather than population averages. And more accessible, reaching people who can't easily get to a clinic. At its best, it puts you in the driver's seat, empowered by real insight into your own body. But, and this is the through line of this whole series, we have to stay clear-headed. Not every gadget is as accurate as it claims. Data alone isn't health, a wall of numbers doesn't automatically make anyone healthier. Privacy is a serious question when your most intimate health information lives on apps and servers. And there's a real risk of a digital divide, where these benefits reach the tech-savvy and well-off while leaving others behind. Digital health is powerful and here to stay, and it deserves to be understood with both genuine optimism and honest skepticism. That's exactly what we'll do, topic by topic, across this series. This is educational, not medical advice.